Welcome. Today we're diving deep into the world of heart disease, specifically focusing on myocardial infarction, also known as a heart attack. We'll explore what it is, why it happens, how it's diagnosed, treated, and most importantly, how we can prevent it.
So, let's get started.
Myocardial infarction at its core is caused by a lack of blood flow to the heart muscle. The most common culprit is atherosclerosis. This is where plaque, composed of fat, cholesterol, and other substances, builds up inside the arteries. Over time, this plaque can rupture, forming a blood clot. This clot can completely block the artery, depriving the heart muscle of oxygen and nutrients. Other, less common causes include coronary artery spasm, which is a sudden tightening of the artery, or embolisms, where a blood clot from another part of the body travels to the heart. Let's delve into the pathophysiology. When a coronary artery is blocked, the heart muscle downstream is starved of oxygen, a condition known as ischemia. If this ischemia persists for too long, the heart muscle cells begin to die. This is infarction. The longer the blockage remains, the more extensive the damage. This damage can lead to a decrease in the heart's ability to pump effectively, causing a cascade of complications, including heart failure, arrhythmias, and even sudden cardiac death. The specific area of the heart affected and the amount of damage determine the severity and consequences of the heart attack. Myocardial infarction is a significant global health concern. The incidence varies depending on factors like age, sex, ethnicity, and lifestyle. Men are generally at higher risk than women, especially before menopause. However, after menopause, a woman's risk increases significantly. Individuals with pre-existing conditions like high blood pressure, high cholesterol, diabetes, and obesity are also at a higher risk. Smoking, a sedentary lifestyle, and a family history of heart disease all contribute to increased prevalence as well. Recognizing the signs and symptoms of a heart attack is crucial for timely intervention. The most common symptom is chest pain or discomfort, often described as a squeezing, pressure, or tightness in the chest. This pain may radiate to the left arm, shoulder, neck, jaw, or back. Other symptoms include shortness of breath, nausea, vomiting, sweating, lightheadedness, and a feeling of impending doom. Importantly, women may experience atypical symptoms, such as fatigue, indigestion, or pain between the shoulder blades. If you experience any of these symptoms, seek immediate medical attention. Diagnosing a myocardial infarction involves a combination of tools. An electrocardiogram, or ECG, is vital. It measures the electrical activity of the heart and can reveal characteristic patterns that indicate a heart attack. Blood tests are also crucial, specifically looking for cardiac enzymes, such as troponin, which are released into the bloodstream when heart muscle is damaged. Further tests like echocardiograms or angiograms might be performed to assess heart function and visualize the coronary arteries to pinpoint the blockage. Myocardial infarctions are often classified into two main types, STEMI and NSTEMI. STEMI stands for ST elevation myocardial infarction. In this type, the ECG shows a characteristic ST segment elevation, indicating a complete blockage of a coronary artery. NSTEMI, or non-ST elevation myocardial infarction, is characterized by other ECG changes or elevated cardiac enzymes with a ST segment elevation, suggesting a partial blockage or less extensive damage. Differentiating between STEMI and I is crucial as it dictates the immediate treatment strategy. The primary goal of treatment for myocardial infarction is to restore blood flow to the heart muscle as quickly as possible. For STEMI, the gold standard is reperfusion therapy, either through percutaneous coronary intervention or PCI, which involves inserting a catheter to open the blocked artery, or through thrombolytic medications, which dissolve the blood clot. For NSTEMI, the treatment approach depends on the individual's risk factors and may involve PCI, medication management, or both. Medications used in managing myocardial infarction include antiplatelet agents like aspirin and clopidogrel, anticoagulants like heparin, beta blockers, ACE inhibitors, and statins. Lifestyle modifications, such as cardiac rehabilitation, are also crucial for long-term management. Prevention is paramount when it comes to myocardial infarction. Adopting a heart-healthy lifestyle is key. This includes eating a balanced diet low in saturated and trans fats, cholesterol, and sodium, and rich in fruits, vegetables, and whole grains. Regular physical activity, maintaining a healthy weight, quitting smoking, and managing stress are all crucial. Regular check-ups with your doctor to monitor blood pressure, cholesterol levels, and blood sugar are essential for early detection and management of risk factors. The prognosis following a myocardial infarction depends on various factors, including the extent of heart muscle damage, the presence of other medical conditions, and the individual's adherence to treatment and lifestyle modifications. Early diagnosis and prompt treatment significantly improve outcomes. Recent research focuses on developing new therapies to protect heart muscle from further damage, improve heart function after a heart attack, and prevent future events. Gene therapy and stem cell therapy are also being explored as potential treatments to regenerate damaged heart tissue. Continuous research and advancements offer hope for improving the long-term health and quality of life for individuals who have experienced a myocardial infarction.